Thanks so much for sticking with us for our second half hour of News 5 at 4. I'm Diane Derby. Allison is off today. Doctors say Colorado is experiencing an unusual flu season this year. Typically, the season peaks in December and January. This year, it happened in May. News 5's Ashley Portillo has been talking to doctors about what's going on. Ashley.
Diane, so doctors say the number of flu cases that they saw in the month of May is something they have never seen before. And they're also saying if you got a flu shot last fall, it may not protect you right now.
I've been in infection prevention for over 20 years, and I can tell you I've never seen a flu surge in May. It's just not been documented.
Dr. Michelle Barron is the Senior Medical Director of Infection Prevention for UC Health. She says the normal peak of flu season is in December and January, but this year it's later than normal.
So it was around the time when all the mask mandates went away. We had spring break, and then we've also had, graduations.
Dr. Barron says nearly 500 flu cases were reported a week in Colorado's most populous counties in December of last year. Last month, it tripled to nearly 1,500 per week. She blames it on people taking fewer precautions to stop the spread of viruses.
And I think we just kind of shifted everything because a lot of the stuff we were doing to prevent COVID was actually preventing flu as well.
Meanwhile, a local doctor says he's also seen an increase in patients coming in with respiratory illnesses.
In the past several weeks, we have seen lots and lots of respiratory infection. A lot of those are influenza, a lot of those are COVID.
Dr. Richard Vu is a local physician and says overall the flu season has looked different since the pandemic began.
The last few years we have seen a deviation from that, and the last 2 years because of COVID.
And Dr. Barron says since the peak in May, cases of the flu have been going down. But she has a warning for anyone who got a flu shot last fall.
And it probably isn't effective. The reason we give it in the early fall is in anticipation that you're going to see most of the flu cases in December, January.
And both of those doctors say you can still get a flu shot right now and get one again when it's typically recommended later in the fall. Diane.
Ashley.